Right now, I'm injecting to the lips. Usually, I like to use S100 or S300 for lip augmentation. For upper part, I like to make a point to enhance the familiar border, not just making a big lips, but the enhance that familiar border is very very important for Oriental peoples and for Korean peoples. So you might think about a little bit different, but it's common to inject to the uh, to make a vermilion border just like that. And for injecting them, sometimes I'm using 27 gauge, or sometimes I like to use a 330 gauge of needle. So for lower part, lower lip, Oriental peoples doesn't like a very big lips. They just like to want to make a shape of the 2 points of the lower lip. So inferior labial artery is running to the mucosal part. So you can inject directly, not just a very high, very big lower lip, but just 2 points I inject to augment the very to make a bigger lower lip. You should make a big lower lip than the upper part. So right now I'm having a molding of the lower lip, and I use the 300. Yes. So that yeah, as I told you last time, for the delayed hypersensitivity, I like to use steroids for oral medication and antibiotics. Yeah, I just told you before. And this is 3 weeks after. Is it 2 weeks after? 3 weeks after we are retouching the uh, upper lip part, because she want to make a little bit bigger because she's the Western. For Korean, if she was a Korean, she won't do that thing. But anyway, she wanna make a bigger lips. So I'm making a retouch of the injection, and also that she's also up for the upper part. I make a enhancement of the vermilion border. Some of my colleagues, some doctors like to make a eversion of the lips, so they are like to inject to the mucosal part, but as you know, that the superior labial artery and the inferior labial arteries like tend to run to the mucosal part, so it is quite dangerous for the injecting that area.